it has changed dramatically in the last 10 years. It's a fragmented industry. A lot of very small mom and pop kinds of organizations who do this as yes, as a living, but more as a passion and as a mission. And some of them are very, very successful and do a great job. Others, struggle. But a lot of small places everywhere, almost all not for profit, some for profit. Then, as time has gone on, there's been the growth of a handful of extremely large aggregators, if you will, organizations that saw the fragmentation and said this is a perfect opportunity to uh, combine operations, get scale, get scope, use our market abilities to go after commercial insurance and advertising. And so very attractive to private equity and venture capital, and some of the very largest behavioral health systems, hospital systems. Those are organizations and environments who historically, even the ones that were not for profit, um, sought a commercial based uh, population. And um, frankly, nobody looked all that carefully. The insurers didn't. Uh, Quality was variable. Marketing mattered. Uh, Lots of behaviors that were not so great in some parts of the country, where people would be attracted to a setting because it had gourmet food and yoga and a beautiful campus and horseback riding, but not necessarily because the quality of the care was any better or that people got more of what they needed. Um, as the market became more competitive, as commercial insurance became and managed care looked to squeeze every dollar out of everything it could squeeze, this seemed like an uncontrolled area. So uh, they clamped down a lot more. And as they clamped down a lot more, margins became thinner and thinner. Um, and on the edges, organizations didn't want to have empty beds. So even though they didn't necessarily desire to be reimbursed by the more traditional community mental health or behavioral health Medicaid state grant kind of reimbursement, they began begrudgingly to move into that territory.